Hey guys, and welcome to today's video about inflammation. Inflammation is the body's response to irritants, injury or infection. Its main aim is to remove all the dead cells and to initiate tissue repair. There are 5 signs to look out for when trying to recognize inflammation, and these are known as the 5 cardinal signs of inflammation. Rubor, which is redness; calor, which is increased heat; tumor, which is swelling; dolor, which is pain; and functio laesa, which is loss of function. These are in Latin because the first 4 were identified by a guy named Celsus, and the 5th was later added on by a guy in the 19th century called Virchow. The redness and heat are due to the increased blood flow to the sites of injury. A large amount of blood, which is at body core temperature, is being pulled towards the surface where it is normally cooler. Pain occurs when the pain receptors are triggered. When inflammation occurs, chemicals are released that make the pain receptors even more sensitive. So what this means is that the receptors are triggered even to low-level stimuli, such as the grazing of clothing across your skin. Pain is also felt when the site of injury has reduced oxygen levels, causing cell death, and or due to physical trauma. These 5 cardinal signs of inflammation are useful for spotting signs of inflammation outside the body. But how about inflammation that occurs inside the body? If someone has a lung infection, they will not feel any pain because there are no pain receptors there to be triggered. And regards to the redness, well, you can't really see, can you? So inflammation that occurs on the surface of the body is relatively simple to recognize. However, internal inflammation that does not cause any pain may require a special blood test to illustrate inflammatory markers. There are 2 types of inflammation. They are acute and chronic. Acute inflammation is good. You hit your toe on the table leg, it swells up and it pains. Good, it's healing. You twisted your ankle and sprained a ligament, it swells up and it pains. Good, it's healing. You fall over, your lower leg's bent at an abnormal angle. Not good. Go see a doctor. There are 3 main things occurring in acute inflammation: increased blood flow, increased permeability, and the movement of white blood cells. The increased blood flow occurs due to a process called vasodilation. This is initiated by certain chemicals being released, allowing the smooth muscle in the vessels to actually relax and expand. Due to the increase in blood flow, the pressure within the capillaries increases as well, which in turn also increases the extravascular space, which is basically the space between the cells. This allows for the simple movement of protein between the cells. This net increase of protein-rich fluid escaping towards the surface of the body is visible as swelling around the site of the injury. All of this together finally allows for the migration of white blood cells to the site of injury, helping the body remove the dead cells and initiate tissue repair. When acute inflammation occurs over a prolonged period of time, it becomes chronic inflammation. This can last for months, even years. This can be caused by either a failure to eliminate the cause of acute inflammation initially, a virus or bacteria, or even an autoimmune disease such as rheumatoid arthritis. Just a thing to remember, people. I've seen various websites describing the stages of inflammation, but actually mistaking it for the stages of soft tissue healing. Inflammation can be divided into stages itself. However, it's also the initial stage for soft tissue healing. I hope this video has helped you understand briefly what inflammation is. Be sure to like, comment, and subscribe. Take care, and I'll see you later.